Looking at the digital transformation over several years, several decades, actually, if you look at 2020, today being in 2021, the pandemic actually accelerated the digital transformation. I could tell you personally, as someone who's been in this healthcare space, the transformation that we've seen in the last year, we would not have seen occur for several years had the pandemic not hit. And so this really pushed the envelope and allowed providers to see the value in the technology that was being provided, and also to understand the need of having all of this data accessible at your fingertips. So from analytics, artificial intelligence, using information and communication technologies, and really being wellness focused so that we can provide a holistic view of the patient and have preventative care. And so what this leads to is really patient-centered care versus disease-focused care. So what is patient-centered care? It allows you as the patient to have that direct access to patient care, and also looking at a patient's record through the perspective of the patient. So what does the patient do on a daily basis? What do they have access to? Like I said, the technologies that are at their fingertips should also be data that the providers can have access to, so that they're really giving you data-driven and value-based care. So looking at some of the patient-centered care, it's virtual care visits, e-prescribing, direct messaging, all of the things that occur within the doctor's office, but really also looking at the health journey of a patient from wellness to chronic disease management over time. So that's just a little overview, and I want to hand this over to Nikki so that she can introduce our keynote speaker for today, who's going to give us a wonderful presentation.
Thank you so much, Meggie, and thank you, Whitney and Summer, as well. I'm actually super excited to be able to do this with you guys. Our health tech and life sciences group at Tech Hub is brand new, and so Meggie's helping us leading that charge. And I'd love to introduce Mihai to you, because Mihai is longstanding member on our board, leads our Tech Talent and Education Committee, and also part of our new life sciences group. So I'm really happy to introduce him. So a little bit about him here. Mihai Fonoage is the Vice President of Engineering for Modernizing Medicine. In this role, he leads a team of engineers, team of engineers and quality assurance professionals that are working on building high quality software for medical practices to increase efficiency and improve patient care. With over 14 years of experience in the technology world, his technical prowess has strongly contributed to Modernizing Medicine's success. Mihai has a PhD in computer science from Florida Atlantic University and was Modernizing Medicine's first employee, which most people don't know, and I think is awesome, by the way. He is a recipient of Sun Sentinel's 2015 Top Workplace Professionals and the South Florida Business Journal's 2014 40 Under 40 Award. Mihai also serves as an executive board member for Tech Hub South Florida, holding the position of chair for our Tech Talent and Education Committee. So I'd like to hand it over to Mihai. And please feel free to take it away, Mihai.
Sounds great. Thank you so much, Nikki. Thank you so much, Meggie. And good morning, everybody. Thank you for having me here. It's great to kind of be here as a use case, as an example of how do you apply digital transformations into healthcare. So let me share my screen. There we go. Perfect. I'm going to bring this screen here forward so that I can actually look at the camera. And then I'm going to make it in full screen.
And while Mihai is sharing his screen, I just wanted to let everyone know we are recording this presentation today so that we can share it later with you. So thank you, Mihai.
Absolutely. Before I move forward, I do have a disclaimer. You will see some of these statements are really forward-looking statements, and there's really no assurance that they will actually prove to be accurate in the future. That's a disclaimer that we do at the beginning every time. So now let's move into something more fun, more exciting. So let's start with the mission, right? And we really are really aiming to transform healthcare through smart, intelligent platforms that are very medical specialty specific, with two main goals. One is to increase the efficiencies of the practices that we serve, and second, to really improve the outcomes of their patients. So once you realize this mission, what happens is that you now live into a world where the smart, intelligent technologies that we create really improve the health, the happiness, and the overall well-being of all the medical providers and their patients. So a little bit of history. We were founded in 2010 by Dan Kane and Dr. Michael Sherling, and it's a very interesting story. So Dan went to a routine skin check in 2010, and what he observed was that Michael was using a pen and paper to document that patient visit. So he asked Michael, why aren't you using anything that's actually electronic? And the answer was, well, there's nothing out there that's really tailored towards my medical specialty, my needs. And there's nothing out there that really saves me time. So they met afterwards for coffee, and Modernizing Medicine was born. We have reached, actually, I think this year, the huge milestone of being over 1,000 employees, which is really exciting. And our headquarters are here in Boca Raton, Florida. We actually are in the brick building. A lot of history in that building. All right. Are you still seeing the screen? Yay. All right. I think I figured it out. So some of our core values is to really delight our customers through the experience that they share as they go through the products, save them time, which is huge because their time is the most valuable asset that they have. Innovate, be passionate about what you do, obviously aligning it with a purpose, and then think big, have fun, and do good. And it's very hard not to do good when you're in the healthcare space. So our flagship product is a electronic health record system called EMA that it's being used by over 15,000 providers across the US. And how you should think about this is that when you go and see your doctor, instead of the doctor using a pen and paper, what they will use is our application, our EHR, either in a browser, on the iPad, or based on the type of functionality that they need on the phone or even on the Apple Watch. So we started in 2011 in the dermatology space, and that makes sense since Dr. Michael Sherling is a practicing dermatologist. But since then, we really went into ophthalmology, optometry, orthopedics, GI, and many other medical verticals. Not only that, but we have added, when it comes to our ecosystem, more than just the EHR, we did analytics, practice management, image management, and much more. And I'm going to go into details a little bit later for those. Very fortunate in 2011 to be ranked the #1 EHR in the 7 specialties that we serve. So certainly very, very blessed for that. Now, I do want to highlight some of the healthcare industry dynamics before moving forward, because I do feel that it's very important to talk a little bit about them. So there's certainly an increased complexity when it comes to documenting the patient visit. There's also an evolving need when it comes to operational and the analytical aspects of a practice, especially as you're talking about some of those larger enterprise type of practices. As we all know, we're shifting from fee-for-service to value-based healthcare, and what this basically means is that you're not going to get reimbursed based on how many patients or how many diagnoses you're doing for a patient, but actually you're going to be reimbursed based on the outcome of the healthcare that you are providing to your patient, which is a huge change. We're also seeing a greater patient engagement. Patients want to be part of the healthcare conversation, right? They want to feel empowered, and that's certainly something that's top of mind for us and for many others. There's also rising healthcare costs, and we all know about those. Then there's compliance overhead. Everybody has to kind of go through that. And finally, there's interoperability needs, which everyone has to meet. Now, just by using technology doesn't mean that you're actually solving the real challenges and problems of your users. And here are some stats that really honestly, some of them are just mind-boggling. For example, the majority of the solution out there are really not specifically geared toward medical specialties. They're one size fits all. Another such stat is that most of the technologies that are being used by those systems, by those apps, are legacy technologies. And what this means is that you're not going to take advantage of the newer technologies, the mobile, the cloud, the AI, and things like that, which is truly a shame and a missed opportunity. Another stat that is, it's very hard to really digest is the fact that the average EHR NPS score is -45. And yes, that minus there is not a mistake, right? So what does this mean? This means that even though you have applied technology, when the user uses the application, the workflows are really inefficient for that user. And that comes also with an increased overhead. So this leads to physician burnout. And that's something that has been discussed for the past couple of years. This is certainly always a topic of conversation for HIMSS as well at their annual conference. So just something to be mindful. You're not just by using technology, it doesn't mean that you're doing things right. You really got to start with the problem statement. What is the problem? What are the challenges you're trying to solve? And then figure out what's the technology that's going to help you solve those challenges. Now, healthcare is really our nation's largest immovable object. And the only way to really change it is to use what we like to call unstoppable forces. And there are three powerful forces that we feel that really transform healthcare. The first one is cloud, right? And cloud changes not only how software and services are delivered, but also shifts the responsibility of reliability, performance, security to the company providing it. And why should the medical practice have to deal with all of those, which is the case in a client-server type of an environment? Right? Our users simply need access to internet on any Mac, PC, or iPad. And that's the beauty of the cloud. The second unstoppable force is mobile. And mobile, it's more than just anytime, anywhere, any device access. It really completely changes the form factor of how our users interact with the application. We all know typing is slow. Typing is inaccurate. I can tell you I struggle tremendously typing on my iPhone, tremendously. Not only that, but dictation is also unstructured. Now, a touch-based interface provides tremendous ease of use and accuracy. Now, the intersection of cloud and mobile has really led to the third platform. And Meggie touched a little bit on that earlier. The first platform was mainframes. The second one was client server. The third platform is really cloud and mobile technologies. But our the third force here, really, it's the most powerful force, which is data. Most companies think of data as the output or the exhaust that comes off or out of their application. We have created applications in which data itself is structured and actionable. The data at that point becomes input. So every diagnosis made, every exam finding, every prescription order, every lab sample, right? And all of the specific procedural elements are used to anticipate our users' individual needs. And that's where AI comes into play. The user experience itself morphs, changes around our customers and adapts to their unique style of practice. The more they use the application, the more the application learns all of that. Right? And you cannot do that without intelligence, without AI in the background. Now, when you combine structured data with mobile, what you get is that you can predict what the user wants and really streamline data entry. When you combine structured data with the cloud, you find something very, very powerful, and that's the wisdom in the outcomes. Providers can see in real time benchmarks on everything from prescription popularity to their standing in quality measures. So just think about this possible use case. A new patient comes in, right? Based on the patient's demographics, based on their medical history, based on why they are here and the diagnosis that you have done, you can now look through the data that is gathered through hundreds of millions of visits, find similar patients with a similar history, similar medical background, and so forth, and be able to understand what works and what doesn't. Isn't there a future to strive for? And that is the power of technology. Without technology, you're absolutely not able to do something like that. Now, very early on, we had to make a decision, which was how do we want the medical content to be entered into our application? We didn't want our customers to have to do that through templates and macros. We want that content to reside within our app. So we had two options. One was to teach engineers medicine or to teach doctors how to code. I believe that we made the right choice by actually teaching our doctors how to code. We have created a domain, a healthcare domain-specific language where they enter all of the medical information into our app. And they work side by side with our user experience and engineering teams. Again, the power of technology. Now, there's more than just the EHR. There's the, which is used in the back office, if you will. There's practice management used in the front office for schedule and billing. There's payment processes. There patient engagement solutions, and much, much more. And I'm going to go through a little bit of detail so that we understand how technology is used within all of those aspects. Now, from a practice experience standpoint, before the appointment, you can look very easily at a schedule for the current day, upcoming day, next week. And with a touch of a button, you can send a text, an email, or a phone call to remind the patient of the upcoming appointment. And what happens if you do that? Remember, a touch of a button, everything is automated through technology, is you really help reduce no-shows. Right? And you really help free up the office staff so that they can focus on other important tasks. Love technology. Love technology. Now, during the appointment, you can either use a touch-based, easy to navigate interface, browser or iPad, or you can do a telehealth visit. You can do a real-time video chat. And I want us to go back to 2020, which I don't want to do, but I think it's actually worth it. In 2020, there were a few months where all of the medical practices were closed for obvious reasons. So at that point, the patients were not able to see their providers. So what we did is that in a matter of 4 weeks, we built a real-time video chat, really giving the opportunity for the patients to start seeing their doctors for the much needed care, right? And that's huge. You cannot do that without technology. And a lot of the real-time video chats out there that were very separate from the medical apps weren't HIPAA compliant, although that was relaxed later on, right? Very, very powerful here. And finally, after the appointment, you can automate your billing, your submission of the file claims. You can actually send the prescription right then and there. And what that does is that me as a patient, when I reach my pharmacy, the prescription is already ready for me. I don't have a piece of paper that I need to kind of take and just hand it over and then wait for 10 minutes, right? Everything is automated through technology. Now, from a patient experience standpoint, before the appointment, you can offer the opportunity for the patients to self-schedule the appointment. This means that I don't need to call the practice, get a hold of somebody, spend minutes trying to kind of look at their calendar and my calendar to make that happen. No, you can do it yourself, going online and making all of that happen. Now, during the appointment, again, you can either launch the appointments through desktop or mobile apps, or one of the things that I love, again, it goes back to that video chat and that telehealth visits. And I am very fortunate because within a few minutes drive, I can really go to almost any medical office that I need to go to. But I'm fortunate. A lot of other people that live in remote areas, rural areas, for them to drive to a medical office takes hours. What if they don't need to do that? What if through technology, they can use real-time video chat, video and audio chat to really see their doctors and communicate with their doctors? That is the power of technology, and that's how technology changes healthcare. And then finally, at the end of the appointment, I can pay right then and there using a mobile kiosk, or I can go through the mobile patient portal or the web patient portal and pay that bill. I don't need to get a mail with an invoice and then send a check through mail and do all of that. I can be up and running in a few minutes and be done with it, which is huge. Now, I wanted to show just 2 or 3 screenshots just to kind of highlight how the experience looks, right? And this is what we call the virtual exam room, right? And it's really where a lot of the patient visit documentation happens. Very intuitive, very easy to use, touch-based. Another one, for example, in the orthopedic space, which is this, there's different layers of the human body, really catering towards the orthopedic space here. If you want to draw, not a problem at all. Again, you can use an Apple Pencil, you can use a finger, and you can just draw on the iPad and show it to your patient. And I do want to share a story here. A few years ago, I was visiting one of our customers, and I was in the exam room with the patient and the provider, kind of sitting in the background, observing the interaction between those two. And they were both sitting down, and the provider was holding his iPad, and he was documenting the patient visit, showing what he was doing to the patient who was a little bit older. And something struck me as I was looking at that, which is how mesmerized and engaged that patient was. It really felt like that patient was empowered and was part of his or her healthcare conversation. And that's huge because many times when we go and see our doctors, they still use legacy system or are on pen and paper. Usually they don't face us, right? Usually they're either on the side typing and not kind of looking at us, or they're kind of scribbling down on a piece of paper. At that point, I know a lot of us feel disengaged. I'm not connecting with my doctor. And that's a place where I need to kind of feel safe. I want to have a conversation because I'm there for a reason, most often than not. Right? And that's how through technology, we can really reconnect the physician and the patient, which is huge. And then finally, another example in our ENT space, but also with a real-time video chat as we do that. Now, as we look into the future, and that's something that Meggie also highlighted, AI really, really continues to play a major role, right? And if you think of, from treatment adherence, complication risk and outcome forecasting, image analysis, disease detection, all the way to virtual assistants, chatbots, voice-enabled EHR navigation, even maybe to an ambient voice assistant. Think of Alexa for healthcare. I mean, the future looks pretty exciting. So I want to give you a glimpse into what's possible, how the practice of the future could actually look like. So let me play this video for you. Doesn't really the future look very exciting? And that is really how you combine technology with really solving the needs, the problems, the challenges of your users into something that could look quite like this. So with that, I want to thank you, and please ask any questions. I'm happy to answer them.
Thank you so much, Mihai. We really appreciate that. That was great. If you have any questions, you can go ahead and unmute yourself, or you can enter it into the chat. No questions yet? Okay. Well, I'm going to turn it back over to Meggie. Again, you have the contact information for both Mihai and Nikki in the chat, so take a look there. If you have any questions after the fact, let us know. I did record this and I will be sending this out later. So Meggie, if you just want to give us kind of a synopsis of what's going to go on and for our next meetings.
Yeah, sure. Before we do that, just, thank you, Mihai. That was wonderful. And I love this collaboration. We just want everyone in the audience that's in the healthcare space to really understand the possibilities and what can be done with technology that can truly support you, so that you have access to your healthcare data at your fingertips. I mean, we have that today with our groceries, our movies, So why not our healthcare? So that's just something to really think about and digest when you're looking at the spaces that you are all in. We do have our April event. Before we go into the April event, we have an event on Thursday, Behavioral Health Amidst the Pandemic. I hope that you all register for that. That will be streamed live on the social media platforms, but we have some really big industry leaders and thought speakers in the behavioral health space that are going to be speaking about behavioral health resources, the impact that has occurred over the pandemic. And we're also going to be speaking with some thought leaders in the mental health space in April as well. And then Whitney, if you want to elaborate a little bit more on that, that would be great.
We did get a question in while you were speaking, Meggie, for Mihai. How do you think that COVID-19 has changed the need for technology in the clinical arena?
That's a great question. And I think really kind of what it highlighted is the fact that, for those use cases where for various reasons, you're just not able to physically go into the office and just see your patients. At that point, you need to kind of fall back to something else. And that is, technology helping you in a virtual system, in a virtual setting, go and see your patients. So really, honestly, I think it just highlighted the need to have different complementary solutions out there for the different use cases, right? Because once this is over and you can much more easily go and still see your patients, there's still a need, there's still use cases where you could do a lot of those things sitting at home or at work and virtually seeing your patients. So it really pushed the need of having, telehealth, having video chats really made easily available so that the patient and the providers can see each other.
Thank you so much, Mihai. Again, I would like to thank you so much for taking the time to speak with us today, and to Nikki and her team as well. We do have the panel, as we mentioned, on Thursday at 11 a.m. It's virtual and it's free to all members. For those of you who are not members, you can watch it live on Facebook. So please go ahead and register for that on our website. I want to thank Compounding Docs. I see Susan Kaplan here with Focal Group for their presenting sponsorship of that panel, and we're looking forward to that on Thursday. And we will see all of you for the next meeting. I will send this recording out to you guys in the next week or so. So thank you again so much. And if you need anything at all, please feel free to message me after. Thank you, Summer, and thank you, Meggie and Nikki and Mihai.
Thanks, everyone.
Thank you.
Thank you.
Bye.